AASLD 2023 has been really exciting for people living with PBC. A number of new trials reported during this conference and in the late breaker session. One of those was a trial of seladelpar, a PPAR delta agonist, in the treatment of PBC. This was a trial for patients who don't respond fully to UDCA or who were intolerant of UDCA, and it took patients who therefore had abnormal liver tests, alkaline phosphatase above 1.67, and randomized them to seladelpar or placebo. Seladelpar was dosed at 10 milligrams daily, and over the period of 12 months, biochemistry was monitored, and in addition to biochemistry, symptoms were monitored, particularly itch. The primary endpoint was what's known as a composite biochemical response of alkaline phosphatase and the change in alkaline phosphatase, but there were key secondary endpoints including normalizing alkaline phosphatase and improving itch. The reason I think this presentation got a late breaker alongside another presentation on elafibranor was the results. So at 10 milligrams daily of seladelpar, 6 out of 10 patients at 12 months met the composite endpoint. This was really driven by an alkaline phosphatase drop of over 40%, or more than 130 units drop in alkaline phosphatase. So clearly meeting its primary endpoint. Furthermore, seladelpar actually, after only 12 months of treatment, 1 in 4 patients normalized their alkaline phosphatase, which is really where the treatment goals are headed. Another key secondary endpoint in this study, as I mentioned, was itch, a very burdensome symptom for patients. In the study, the key secondary endpoint was to see whether those patients with moderate to severe itch, and that was measured by something called the NRS, the numeric rating scale, if for patients where the NRS was greater than or equal to 4, the question was asked what happens at 6 months to their itch score. And in this study, the key secondary endpoint was met. So the NRS improved and patients had an improvement in their itch. Moreover, their itch actually continued to improve up until 12 months. And furthermore, when you look at the whole population of patients in this study, there was also a significant improvement in itch. The final thing was that itch is often associated with other symptoms, and so you can measure itch in a number of ways, 5D itch, PBC-40. So the 5D itch and PBC-40 data was the same. 5D itch includes an itch domain and also a sleep domain. Pleasingly for the patients involved in the study, not only did the itch improve over the course of the trial, in fact, sleep quality improved as well. Furthermore, there are some mechanisms behind itch in patients with cholestatic liver disease, and there's some emerging data about a pruritigenic cytokine called IL-31, and seladelpar treatment as compared to placebo reduced the IL-31. Finally, of course, safety is very important. And there were no unexpected and no signals of concern from a safety perspective. So overall, at 10 milligrams daily, seladelpar led to 6 in 10 patients meeting the composite response, 1 in 4 patients normalizing alkaline phosphatase, an over 40% drop in alkaline phosphatase, and statistical significance in a predefined analysis on itch at 6 months, and then over 12 months, and in addition, in fact, itch improved in all patients, not in all patients, but itch improved across the whole study. So I think that's, one of a few highlights for AASLD 2023 for me. So at the moment, we have ursodeoxycholic acid and obeticholic acid on the market. And many will also know that there's been off-label use of bezafibrate, particularly in Europe, a pan-PPAR agonist for the treatment of PBC. So there's been data where investigators have combined all three. Essentially, patients are on urso, obeticholic acid, and bezafibrate. There's now actually formal trial data, some of which was presented again at AASLD 2023, of combination therapy where obeticholic acid and bezafibrate are in the same tablet. This is also very interesting and very exciting because this took patients with insufficient response to UDCA and looked at the effect of bezafibrate alone and the effect of bezafibrate and OCA in a single tablet. And not unsurprisingly, and in keeping with the real-world experience, there really are significant improvements in alkaline phosphatase and significant rates of normalization. So we're starting to learn, much like other fields like hypertension or hyperlipidemia, hyperlipidemia, the concept of combination therapy in PBC, the concept of using FXR agonists and PPAR agonists together, and from a patient perspective, the concept of pill burden, trying to reduce the number of pills a patient takes. So we eagerly look forward to more data, because this is early phase 2 data, but certainly early phase 2 encouraging data. There was also other studies at this meeting about real-world use, again of obeticholic acid, showing really quite similar experiences to the original pivotal trials, and then the sequence of adding in a third drug, such as an off-label fibrate, again showing that synergy between FXR pathways and PPAR pathways are clearly evident, and it's clear that as a community of doctors looking after PBC, we have bought into the concept that our patients do the best if they get normal tests. And that's why we're interested in this regulatory endpoint, the composite endpoint, but it is a regulatory endpoint. Really, the practice endpoint is heading towards normalization, and that's why the studies are really focusing on that now. I really think that 2024 and beyond is going to be very exciting for patients, and there'll be more and more opportunities to choose drugs that suit them.